Yesterday, a grim milestone, 121,000 new infections, the United States setting a world record, not the kind of record you want. That was Thursday. So let's talk more about where we're headed. We invite into the stream Dr. Faika Chema, Hartford Hospital's Director, Transplant Infectious Disease. Good to have you here. How do we ever put this genie back in the bottle? It seems as if too little too late. What can we do?
Thanks for having me. When you look at what's happening in the world, as you can see, the total confirmed number of global cases of COVID have gone up to 48 million in just a week. I was looking at those cases last week. In about 7 days, they've jumped up by 4 million cases. And when you look at the total confirmed number of deaths of COVID, they've surpassed 1.2 million. We're definitely, in a point in time where the number of cases are getting a little bit out of control. And when you try to focus on what's happening in the United States, the situation seems very grim. Overall, we're seeing a 44% increase in cases, and the total number of deaths have gone up by 13%. And about more than 9 million people have been infected by this virus. And we're definitely leading on this front. And like you said just now, it's definitely not a category we want to be on top of the charts. Just the total average number of cases have gone up considerably from a country which makes up less than 5% of the world's population, but has greater than 20% of the total global COVID cases. So I'm definitely, worried, and I have been worried for a long time. I think all of us are closely in healthcare and public health are closely monitoring the situation. And we're trying to get our message across to everybody that we need to really hunker down. We need to listen to the experts. They're giving us accurate information. And we need to avoid, wear our masks and avoid being in closed, crowded spaces, especially as the temperature drops.
Dr. Chema, going off of that, and how are you preparing? Because I think the question out there is how much worse can this get at this point? If we're in the beginning of November and we're already seeing over 120,000 new cases per day, what is that number going to look like in December or in January? And how are the hospitals preparing for that?
So the Institute of Health Metrics published some data, which I really like to share every time people ask me this question. And they predicted that if we continue with how things are going and the way we've been behaving, the total number of cases and the total number of deaths are expected to surpass 380,000 by February 1st. If we were to relax our policies about wearing masks and physical distancing, the death toll can drop down and improve a little bit to 314,000. But if we were to, if we were to relax our policies, the death toll would increase 100 million by February 1st. But if we were to continue wearing our masks and continue with social distancing, we could improve our death toll down to 314,000. So those are really important numbers to focus on. And I know everybody's waiting on some magic pill with a novel therapeutic because there's a lot of conversation on that. And everybody's waiting around for a vaccine. But I just want to take a minute and comment that even a vaccine, when it comes out, it won't be the magic bullet. And even for several months to almost months later, even after a vaccine comes out, people will be expected to wear their masks, to continue with the physical distancing and this, the guidelines that are in place right now.
It's been bad.
Like so many restaurant owners in the Orange Circle, Cheryl Turner is struggling to stay open during the pandemic.
It has not been easy.
She had to move her tea room out in the street.
Well, the gutter fills up pretty fast. It's raining really, really hard.
With the cold weather and rain on the way,
So I had to get a winterized tent.
Turner has a new set of challenges.
I am worried about it. When we heard that we were going to have rain tomorrow, we were trying to figure out, okay, how are we going to do this? And the servers they have to come out through the front and make it under here without getting people's food wet. So we're talking about umbrella holders and things like that. I mean, it's like Things a year ago you would have never thought you ever had to worry about.
She's not the only one.
This is the first day that we've had some really cold weather.
As holiday decorations go up,
It gets in the 60s and everybody's like, oh my gosh, what am I going to do?
restaurant owners like Will D are finding ways to serve in spite of the shivers.
We ended up working out a deal with Home Depot where we actually bought 25 heaters. We have a tent coming that we'll be putting out.
These restaurants survived a sweltering summer, they say, because loyal customers kept them in business. Those we spoke with said that's not going to change just because there's a change in the weather.
Oh, it's California, so really you throw on a sweater and you're fine. And we're right next to a heater. The restaurant community has already been hit so terribly. You know, we want to support them. We can't really gather with family and friends, so this is probably the safest way.
OC is not cold at all, so it's kind of fun to be downtown with all the lights and having it be cold. It's kind of a fun, like, winter.
It's like a little Christmas movie, and they have heaters and like they have all the lights and stuff.
Most restaurants out here in the Orange Circle have already spent thousands of dollars this summer on makeshift tents like this one. And now they're going to spend thousands more on winterized tents that are waterproof and heaters to keep guests warm. In Orange, Stacey Butler, KCAL 9 News.
For the third day in a row, the U.S. has set consecutive records of more than 100,000 new cases of COVID-19 in just 1 week, infecting a population larger than the entire city of Milwaukee. And overnight, Texas became the first state to reach 1 million confirmed infections. With many hospitals reaching their limits, healthcare workers on the front lines are being pushed to the max.
I didn't want my patient to die alone.
Many who work in the ICU with COVID patients now battling the virus themselves.
Thinking about my wedding day and trying to remember what my kids' laughs sounded like.
Miriana Cisneros, a mother of 3, in the best shape of her life, was nearly crippled by COVID.
I couldn't move my limbs. I just couldn't move.
States like Minnesota, Indiana, and Illinois seeing record surges as Illinois' governor closed indoor dining statewide to try and stop the spread.
We're definitely potentially coming to an inflection point where it could go exponential.
A frightening reality that's sweeping the nation. Doctors are fearing the perfect storm. With Thanksgiving 3 weeks away, they're warning the public against large gatherings. But for so many this year, there will be an empty seat at the table.
In a matter of minutes, my life changed.
Juan Jose Martinez, just 19 years old, is left taking care of his 4 young siblings after his mother died from the virus.
One day I was just, a regular 19-year-old, and the next day I was, managing bills.
It's a reality for too many families who are urging others to act now, before it's too late.
With colder temperatures settling in across the country, causing more people to go inside, and with cases numbers just skyrocketing, we're facing a very risky holiday season. Kristen and Peter.
All right, Megan Fitzgerald, thank you so much for that report.
Well, the U.S. has registered almost 100,000 coronavirus cases in a 24-hour period. That's a new record in the pandemic there. Infections have been surging across the country, but as a percentage of the population, the Midwest is currently hardest hit. And in addition to rising cases, hospitalizations are also soaring. North Dakota says it has only 6 free intensive care beds left in the entire state. More than 230,000 people have now died in the U.S. after catching the virus. Well, for more, let's bring in Peter Chin Hong from the University of San Francisco. He's a medical educator who specializes in treating infectious diseases. Thanks for being with us. Could going to the ballot boxes, in other words, voting in person, do you think that could have accelerated infections in the U.S.?
It certainly could have, Terry. Masks weren't mandated in voting facilities in the United States during the season. In fact, even if your state has a mask mandate, the federal law didn't permit or didn't mandate or enforce mask wearing at these sites. I'm also concerned that the activities around election time, the buses of supporters, particularly from President Trump, they're not wearing masks. They're in an enclosed space. They're riding up and down these all promote potential super spreading events.
Well, talking about events, economists from Stanford University have calculated that tens of thousands of people may have been infected with the coronavirus during Donald Trump's big election rallies. We just saw some footage from there. Is that plausible?
It's certainly plausible. The exact number is a little bit hard to state. In the Stanford University projections, they didn't look at actual contact tracer numbers, but used projections of like states with similar epidemiology and very similar communities where these rallies didn't occur. Compare those sites, and then that's how you get to the tens of thousands of excess cases. It's definitely plausible. People are not wearing masks in these rallies. They're huddled close together. They're shouting. They're screaming. There's a lot of emotions. And these are the states where there's a lot of coronavirus happening right now. So your pre-test probability of getting an infection in these communities is actually higher.
Now, no winner has been declared yet in this election, but if Biden does become president, what, if anything, do you think will change in how the federal government in the U.S. deals with the pandemic?
Well, I'm afraid, Terry, that the cat is already out of the bag in terms of the rapid rise and the acceleration of infections right now in the wintertime. If Biden wins, he won't be in office until January. And again, by then, who knows how many more hundreds of thousands of infections we'd have in the United States. I think the first thing that Biden would probably do, however, is he's talked about having a national mask mandate, and definitely we'll wait for a national strategy. Those two very simple things for a country haven't really been what we've seen in the last few months in the United States. Every state was fending for itself, except that states weren't able to close themselves off. The borders were porous, and, virus can go from one area to the other, depending on, regardless of what was enforced in one state.
Mr. Chin Hong, thank you very much for talking with us. That was Peter Chin Hong, a medical educator from the University of San Francisco.
Thank you.
And here's some of the other latest developments in the pandemic. Germany has likewise set a new record for new infections in the country. Almost 20,000 positive cases were registered in the last 24 hours. In England, a second nationwide lockdown has come into effect. Tough restrictions on social contacts are in place, and all non-essential businesses will be closed for the next 4 weeks. Denmark, meanwhile, is set to cull all the country's farmed minks after a mutation of the coronavirus was found in the animals.
Rising COVID cases are prompting countries across Europe to lock down. In Greece, cars are streaming out of the capital, Athens, to isolating home villages or second homes. As of Saturday morning, Greeks will only be allowed to venture out for permitted reasons, such as buying food, taking exercise, or walking a pet. Southern Italy suffered less than the north in the first wave of the pandemic, but this time the central government is taking no chances, despite recriminations from the regional administration. The partial 15-day lockdown in the city of Reggio Calabria mirrors restrictions in 3 other regions aimed at stopping a resurgence of the virus. In France, where almost 60,000 new cases were registered on Friday, authorities are trying to keep some essential travel going by providing PCR or antigen testing sites at Paris's 2 main airports. People who need to fly can take one of the tests depending on the requirements of the destination country. In the UK on Friday, Liverpool began England's first citywide trial of coronavirus testing in an attempt to prevent hospitals becoming overwhelmed during the country's second wave. All 500,000 residents, as well as people working there, will be offered repeat tests, even if they have no symptoms. The trial will initially run for 2 weeks. Poland posted a record high number of coronavirus-related deaths on Friday, as treatment began for the very first patient at a makeshift hospital in the country's national stadium. 445 deaths were recorded and over 27,000 new infections.
COVID cases in the United States hit more than 120,000 new cases yesterday and more than 1,200 deaths.
This as we head into the flu season. CBS 2's Dr. Max Gomez tells us it doesn't always mean going to the doctor or the hospital, but you do need to know when to go.
While both this coronavirus and the flu can cause serious illness, hospitalization, and even death, there are many cases mild enough to be cared for at home. That keeps hospital beds available for really serious cases, as well as non-COVID and non-flu patients. Here's how to stay home and when to seek help. Flu and coronavirus have similar symptoms at the start and are nearly impossible to tell apart without testing. You should call your healthcare provider if you suspect either illness, because testing and treatment are very different for flu and COVID. Still, you may be able to stay home with either disease.
People with milder cases of influenza or COVID should pay attention to staying hydrated, monitor their temperature, monitor their breathing, get some rest, and obviously isolate.
While there aren't any approved outpatient treatments for COVID-19, there is a national clinical trial called COL-Corona that treats and monitors COVID patients at home. Then there are prescription antiviral medicines available to treat flu, if you start them quickly. But with either virus, it's important to recognize signs of distress and when to seek immediate help.
People should consider going to the emergency room or calling their doctor if they have severe shortness of breath, productive cough, bringing up a lot of sputum, or any other symptom that is causing them distress that they can't take care of themselves.
Of course, prevention is much better than treatment. That means getting your flu shot right away and wearing a mask at all times in public. And by the way, masks will help prevent the spread of both COVID and the flu. Dr. Max Gomez, CBS 2 News.
And we will have the latest on the Trump press conference from late this afternoon when we are joined by CTV's Tom Walters live from Los Angeles in just a few moments. A glitch with the province's COVID-19 reporting system means we won't be getting specific numbers today, but Alberta's top doctor says we are seeing about 800 new cases. That would be a new daily record. Nicole Weisberg joining us live here in studio with more. Nicole.
Aaron, Dr. Hinshaw calls the steep rise in case numbers extremely concerning and says it shows that the measures the province put in place 10 days ago are not doing enough. The province limited gatherings in Alberta's COVID hotspots, Edmonton and Calgary, to 15 people. And while numbers plateaued for a few days, today a dramatic increase. Hinshaw says there's now more than 2,500 active cases in each city. Most people are being exposed at home and at private gatherings, and many who are experiencing symptoms are not staying home like they should.
We were talking about at least 500 people who did not stay home while symptomatic. This is significant. I am calling on Albertans to please stop all activities if you have any symptoms. Unless our numbers decline dramatically in the next few days, we will have to consider additional measures to bring COVID numbers down in order to protect our health system.
Hinshaw says contact tracers are now having a difficult time keeping up with demand, so the province is changing its approach until more can be hired and trained. AHS will only get in touch with close contacts in priority groups, including healthcare workers, families of children exposed in schools, and individuals who live or work within congregate or communal facilities. Every person who tests positive will still be contacted by AHS directly, but will now be expected to notify their close contacts themselves. Event organizers and workplaces linked to a case will also continue to be notified and are expected to contact anyone who could be affected.
Nicole, did Hinshaw say what new measures could be coming if case numbers don't decrease, and perhaps when?
Aaron, she would only say officials are discussing it, and that if new measures are put in place, they'll be appropriate to where transmission is and to where our numbers are.
All right, Nicole, thank you.
Bronx, when voters cast their ballots there, many had COVID on their minds.
The pandemic has disproportionately impacted the borough, which already has had its share of challenges. CBS 2's Andrea Klein-Thomas takes a look at the long recovery ahead.
We're not okay. No one's ready. No one's okay. Everyone is struggling.
We met 26-year-old Jocelyn Rojas at the Bronx Works Food Pantry. Rojas was furloughed from her once full-time retail job. She's back to work, but only 15 hours a week.
What I make is not enough for me to feed myself, try to feed my mother, try to, maintain an apartment, You still have your phone bills.
She's not alone. The city's unemployment rate is around 14%, but in the Bronx, it's nearly 19%, the highest of any borough. Bronx Works tries to help through various programs. It tripled the number of pantry locations to 12, extended hours and days of service, including at the Morris Senior Center.
For the days that we're open for the general population, we've seen 80% of the people that are coming in now for this particular pantry are all new to us.
City and state assistance that includes eviction and utility moratoriums have been helpful, but many fear what will happen when that's lifted.
Shortly after New York City became the epicenter of the pandemic, the Bronx really becomes the epicenter of the epicenter.
COVID has been particularly deadly in the Bronx, with its dense population, large number of essential workers, and high instances of pre-existing conditions.
I've lost about 8 of my friends.
Lizarette Hutchinson, like so many seniors, mourn alone, struggling with the forced social isolation.
I'm very depressed. I'm very depressed behind it.
On Tuesday, voters re-elected Alexandria Ocasio-Cortez. Newcomers Richie Torres and Jamal Bowman won their races, all vowing to address the deep disparities in the Bronx, as recovery here comes with a lot more ground to make up. In the Bronx, Andrea Klein-Thomas, CBS 2 News.
Some people in a Morris County neighborhood have a new tradition. It's called Virus Ball, a game that can be played outside while complying with social distancing rules. CBS 2's Meg Baker shows us how it works.
Meet the Virus Ball World Champions, 8-year-old William and 6-year-old Patrick Bryan. Their opponent, 60-year-old Ken Thompson, their neighbor across the street on Crescent Drive in Morristown.
If you get in the other cones, you get 3 points.
Virus Ball involves soccer-like penalty kicks from across the street. It's played on Tuesdays, trash day. The cans and cones are goalposts. Mr. Thompson came up with the idea when the pandemic hit.
This started back in March where, we didn't know if we were going to die by touching a doorknob, right? Everybody was scared. Everybody was locked down. This was just a way to be outside.
Also socially distance.
They are super official with matching uniforms.
Mr. Thompson got them made.
Virus Ball is also a learning game of math.
You had a 2-point shot from the outside. If you were kicking the hypotenuse of the triangle, those were Pythagoras points. They were worth 2. But if you missed and hit the can in playoffs, you lost 2.
Always been a little bit of a math nerd, so he wanted to incorporate that.
The game has brought the neighborhood together during these tough times. Bill Bryan grew up here. Mr. Thompson used to help him with math and science projects. Now his kids are bonding with him.
Special. I mean, they all have new friends, and also they probably learned a life lesson to speak with and play with adults and interact with adults.
I also think it was really sweet of Ken to start it and keep it going.
I've learned that I need to practice because these guys are way better at Virus Ball than I am.
The biggest lesson the boys have learned?
Just have fun.
The boys hope to spread the word to other kids about their exciting new game built on friendship. In Morristown, New Jersey, Meg Baker, CBS 2 News.
This just in, what could be a breakthrough in a treatment for COVID was announced in Pittsburgh just a short while ago.
It's a kind of super powerful antibody drug that could be given nasally. CBS 2's Dr. Max Gomez reports this drug comes from llamas.
Antibodies in plasma from recovered COVID patients or made in the lab may be effective treatments for COVID-19, but they do have drawbacks. They're hard to make, expensive, they have to be given by IV, and they're not that stable. That's where Wally the llama comes in. Turns out llamas make human-like antibodies to coronavirus, but they also make tiny fragments of the full-size antibodies dubbed nanoantibodies. Researchers from the University of Pittsburgh isolated those tiny pieces and at a news conference today announced the huge advantages the nanoantibodies have over full-size antibodies.
Our nanobodies are extremely stable. They can sit at room temperature for up to more than 6 weeks, if not longer. And it could be freeze-dried for shipping and for storage, which is really important for the drug development. And rather than having to be delivered through intravenous injection throughout the entire bloodstream, like the monoclonal antibody currently in clinical trials for COVID, our nanobody can be fashioned into inhale mist.
The nano antibodies are also many times more powerful at neutralizing the COVID virus than large antibodies. The drug that will soon be tested in humans will not be made in llamas. That's just where they were discovered. These nanobodies are easy to manufacture in the lab, and because they've been shown to be safe in animals, human clinical trials should be smaller and faster than vaccine trials. Dr. Max Gomez, CBS 2 News.